Health is now on the front burner, according to President Bola Tinubu. And during the week, at the commemoration of the World Universal Health Coverage Day, he unveiled Nigeria's health sector renewal compact and investment initiative between the federal government, all the 36 state governors of the federation, and development partners in the State House in Abuja. We bring you the details in our focus on the FCT. Meanwhile, since we are looking at interventions in the health sector, we have a treat for you today. My guest on the program is the Executive Director of Global Fund, the world's largest financier of AIDS, tuberculosis, and malaria prevention, treatment, and care. As of June of 2019, the organization had disbursed more than $41.6 billion to support these programs. According to the organization, in 2018, it helped finance the distribution of 131 million insecticide-treated nets to combat malaria, provided anti-tuberculosis treatment for 5.3 million people, supported 18.9 million people on antiretroviral therapy for AIDS, and since its founding, has saved 32 million lives worldwide. But before we talk to him, we have an update on the major stories from Nigeria's presidency. This is Dateline Abuja. Hello and welcome to Dateline Abuja. I am Kayla Megwa. Let's get you that update. What happened this week in the Tinubu presidency? Please watch this.
President Bola Tinubu has encouraged members of the economic community of West African states to focus on good governance to address the possible causes of coups in the region. He stated this in his capacity as chairman of the regional bloc during the opening ceremony of the 64th ordinary session of the ECOWAS Authority of the Heads of State and Government taking place in the State House, Abuja. The president asked the leaders to fight for democracy and stand against unconstitutional change of government among member states.
By providing good governance that tackles the challenges of poverty, inequality, and other concerns of the people, we will have succeeded in addressing some of the root causes of military intervention in civilian process in our region. Democracy must win if we fight for it, and we will definitely fight for democracy.
The Federal Executive Council has announced that federal tertiary institutions in the country have been taken off the Integrated Personnel and Payroll Information System, IPIS, with immediate effect. The approval for the exemption is one of the decisions taken at the council meeting in the presidential villa, Abuja. The Minister of Education disclosed this while briefing State House correspondents alongside other ministers on the outcome of the meeting. Vice President Kashim Shettima has hinted of plans by President Bola Tinubu's administration to address what he terms the historic inadequacies of policymaking in the country. Senator Shettima, who represented the president at the 2023 Comptroller General of Customs Annual Conference held in Lagos, says lack of a comprehensive data impedes the ability to make informed governance decisions not just in Nigeria but Africa as a whole. He says the government aspires to position Nigeria as the preferred destination for all stakeholders involved in export and import activities, explaining that the first step is to build the capacity of custom officers in digital technology. Vice President Kashim Shettima has charged members of the newly inaugurated National Council on Privatization to ensure their decisions and reforms impact on the lives of Nigerians across the country. He gave the charge while declaring open an induction program organized for the council members at the headquarters of the National Intelligence Agency in Abuja. He also urged them to align their work with the 8-point renewed hope agenda of President Bola Tinubu's administration. The Senate has suspended receipt of their December salaries to assist the survivors and families of the accidental military drone airstrike in Tudumbiri village, Kaduna State. The resolution followed a motion sponsored by the Deputy President of the Senate, Senator Barau Jibrin, who briefed the House on decisions taken when he led a delegation of the Oba Chamber on a courtesy visit to the Kaduna State Government House. The National Assembly Joint Committee on Judiciary and Human Rights have rejected the federal budget for the nation's judiciary. Committee consequently asked the Minister of National Planning and the Director General of the Budget Office to appear before it within 24 hours over what is regarded as poor budgetary allocation to the judiciary. The decision was taken when the Secretary of the National Judicial Council appeared before the committee. The lawmakers believe that the allocation can compromise the judiciary.
Nigeria's health sector renewal compact and investment initiative was unveiled this week in the nation's capital. The federal government says Nigeria is adopting a more coordinated approach to achieving the desired improvements in the health of all Nigerians. We're bringing you the details of this unveiling in our Focus on the FCT. Please watch this.
Nigeria's health sector renewal compact and investment initiative has been unveiled as the country joins the rest of the world to mark the World Universal Health Coverage Day. Attending the event, organized by the Ministry of Health and Social Welfare, are state governors, traditional leaders, civil society organizations, and development partners. The event commences as soon as President Bola Tinubu arrives, with the Minister of State for Health and Social Welfare giving the welcome address.
The theme of this year, Universal Health Care Day, it's Health for All, Time for Action, reminds us of the urgency and necessity of our endeavors. Today, we mark a pivotal moment in our nation's commitment as we unveil and witness the signing of the Health Renewal Pact, a testament to our dedication to transformative reforms in the health sector. With the support of our esteemed dignitaries, the solidarity of our international partners, we stand poised to turn commitments into actions, translating aspirations into tangible improvement in the healthcare delivery system in our country, Nigeria.
A long list of partners, including the traditional institution in Nigeria, hailed the initiative and pledged their support.
I am so uplifted by the incredible attendance here today. It is acknowledgement that change in the health sector is underway and that we, as development partners, are a part of that change. I am so pleased to see so many of you caring about the lives of Nigerians. So yes, this is a time for action. Yes, this is a renewed hope agenda. Certainly, and this is definitely the radical reorientation of the health sector towards primary health care. And friends, colleagues, this is a time for Nigeria to take center stage to address the issues of maternal mortality, the high rates of stunting, to ensure that every family has access to good quality care. This is, as I like to term, it is Nigeria now.
I commend Your Excellency and your government for your commitment to health reform, demonstrated in the unveiling of the Nigeria Health Sector Renewal Investment Initiative today on Universal Health Coverage Day. It's no exaggeration to say that today could be a turning point for Nigeria and indeed for Africa. The scale of your ambition is a model for other countries. And if implemented, it will send a powerful message throughout our continent that universal health coverage is possible. It can be done. If a country as large and complex as Nigeria can achieve UHC, then anyone can.
I would like to also confirm our total commitment as Muslim leaders, as traditional leaders, happen to be the chairman of the National Council of Traditional Leaders. Our total commitment to this healthcare project We will give our total commitment 100% so that Nigeria will be a healthy country, because we know health is wealth. The most efficient and very cheap vehicle to convey any message in this country is that vehicle of religion.
For those who had a major role to play in ensuring the Health Sector Renewal Compact is a success, this is a historic moment.
We will be adopting a more coordinated approach between the federal government, the state governments, Federal Capital Territory, and all our development partners to achieving the desired improvement in the health of all Nigerians and at the scale that is necessary. Specifically, Your Excellency, we are redesigning the Basic Healthcare Provision Fund, which comprises at least 1% of the Consolidated Revenue Fund provided by the NHA as the foundational basis of the sector-wide approach to do a few things: to ensure more equitable allocation of resources to the poorest and most disadvantaged populations in Nigeria. We expect, and at least we have heard, at least $3 billion in pooled and non-pooled financing in the period 2024 to 2026, which is a huge milestone to be channeled towards improving our primary healthcare system and achieving results for Nigerians. And this represents tremendous contribution from our external partners and your government, Mr. President. But the state governments, where the primary healthcare services will be delivered, we would also expect that they would increase their allocations to health. We expect to double the number of fully functional primary healthcare centers that are receiving the decentralized financing facility for infrastructural upgrades, operational costs, and ensured delivery of high-quality essential PHC package, starting by making the 8,809 facilities fully functional and gradually increasing to 17,000 by 2027 in all the 36 and the FCT, as was directed and signed with you, Mr. President.
Our mandate to collaborate closely with the Federal Ministry of Health and ensure that the provisions of this compact are translated into practical and measurable actions. The NGS Secretariat, on the other hand, would provide robust support in tracking and implementing the outcomes of this compact. In conclusion, I reaffirm the commitment of the Governors Forum and remain steadfast in its dedication to make universal health coverage a reality for every Nigerian.
Federal Republic of Nigeria to address that.
President Tinubu describes the occasion as a highlight of this administration's stand on quality health for Nigerians.
Delivering improved quality health is an underplaying factor in my promise of renewal for all Nigerians. I believe that good population health is both a cause as well as a consequence of economic development. I also know that by increasing investment in health, Nigeria will be accelerating its human capital accumulation and development, likely to enhance our productivity for current and future generations, yielding potential demographic dividend. That is why in our 2024 budget proposal, we have increased allocation to health and social welfare as key elements for our nation's human capital development.
President Bola Tinubu has emphasized Nigeria's commitment to achieving universal health coverage, saying health is now on the front burner. The commemoration of the World Universal Health Coverage Day and the presidential unveiling of Nigeria's Health Sector Renewal Compact and Investment Initiative is a sign that Nigeria is adopting a more coordinated approach to achieving the desired improvement in the health of all Nigerians.
My guest on the program is the Executive Director of the Global Fund, Mr. Peter Sands. We unpack interventions to fight HIV and AIDS, tuberculosis and malaria in Nigeria, their involvement in the unveiled Health Sector Renewal Compact and Investment Initiative, and what the Nigerian government should be doing to reverse Nigeria's embarrassing figures of prevalence in these three diseases. Mr. Peter Sands, welcome to Dateline Abuja.
Thank you. Great
All the way from Geneva for this particular event. I want to get into this initiative of the Nigerian government and why it was so important for you. You're from the Global Fund. Why it was so important for you to fly all the way here for this?
Well, to start with, what the government is doing here, what the president launched today with the coordinating minister of Health and Social Welfare, is a real milestone. It's the first time you've seen such an explicit commitment to universal health coverage and an overarching, a sector-wide approach. So it's a big step. And why for the Global Fund? Well, the Global Fund commits, well, we're committing over $900 million to Nigeria over the next 3 years. That's more than the Global Fund invests in any other country in the world. So it's really important for us that Nigeria is successful.
I mean, we smile when we hear, oh, they're bringing so much money to invest, but it also is a pointer to our need. Talk to us a bit about, the burden of these diseases on Nigeria and why it is crucial for projects like this one that has been launched by the president to get the kind of funding that they need, to get the kind of impact that they should make.
Well, let's start with malaria. Nigeria, I suppose it wins a race you don't want to win, which is that you're the world leader in malaria, with 27% of global malaria cases, 31% of global malaria deaths. And to put that in easy to understand numbers, that means something close to 4,000 Nigerians die of malaria each week, and 94% of them are children under the age of 5. There is a real opportunity. We know as a world, we have the science to beat malaria. And if you want to transform the life of some of the poorest people in Nigeria, one of the most powerful things to do is to get rid of malaria.
There's been talk about a malaria vaccine in parts of West Africa and of course in Nigeria as well. Is the Global Fund got anything to do with that?
We have been working with partners like Gavi and Unitaid on the bringing to market of, there's actually two vaccines now, one called RTSS and one called R21. And they are really welcome, important additions to, in a sense, the toolkit we have to fight malaria. But I think it's important that people recognize that these are not, they're not kind of magic wand vaccines. They're not going to solve the whole problem. They still have to be used in conjunction with things like bed nets and treatments and diagnostics. They're a helpful addition, but they're not going to instantly solve the problem.
Between the time when Kofi Annan and former President Obasanjo just came up with the idea for the Global Fund
here in Abuja,
yep. And now, what would you say has the impact has been? Has it been successful with the, well, maybe not eradication, but reduction in the prevalence of malaria, tuberculosis, and HIV?
Well, 59 million lives saved. That's one mark of success over the 20 years of the Global Fund. But another would be the fact that if you take the combined death toll across the three diseases, HIV, TB, and malaria, the annual death toll is 55% lower than it was 10, 15 years ago. So it's dramatically lower than from its peak. It's still too high. We need to reduce it further. But we have made significant progress. The reality is that far too many Nigerians don't have access to even pretty basic healthcare. Saving a child who's got a fever because of malaria is all about having access to healthcare within 24 or 48 hours of the fever appearing. There's too much maternal mortality still in this country. And again, that's about access. We still see too many cases of what we call vertical transmission of HIV. When an HIV positive mother gives HIV to the baby, that is completely avoidable. But it requires access to antenatal services. So what the government is setting out is a very ambitious approach to ensuring that everyone in Nigeria has access to the kind of primary healthcare services that can save literally millions of lives.
Primary healthcare is one of the biggest issues that we face when it comes to healthcare delivery in Nigeria. What in your view, and maybe from your experience dealing with healthcare around the world, should we be doing differently with our primary healthcare centers to ensure, that basic treatment gets to people, especially in local communities?
Well, I think a number of things that are important about today's launch was the partnership between the different levels of government, between the federal government, the states, and local governments, because actually a lot of healthcare delivery can't be controlled and run sitting here in Abuja, right? Primary healthcare delivery is primarily a locally delivered service. And so I think that partnership is incredibly important. A second thing that we've seen in many parts of the world as being critical to success is active involvement of the communities, making healthcare something that the communities themselves own and engage with and lead on, rather than something that happens to the communities. And I think the third part of it that's really important is a constant focus on outcomes, on measuring the impact in terms of lives being saved, in terms of infections being reduced, so that you can always be saying, why is this place not doing as well as that place? What's getting in the way? How can we improve? And so on. And I think if you're getting the different bits of government to work together, if you're working with communities and you're keeping focused on outcomes, then you can really make powerful changes.
I'm listening to you talk about healthcare, and I can't help but think about the fact that you used to be a banker. You used to be CEO of Standard Chartered.
It's true.
And here you are with all of the, why the switch? How did you move from the banking sector to healthcare and with such a passion for it?
Well, I had a great time as a banker. I ran Standard Chartered for 9 years. I used to come here mainly to Lagos then, because I was meeting business customers because Standard Chartered had a significant business in Nigeria. But when I had been a CEO for 9 years, I decided I wanted to do something completely different. And I've always been interested in health. And I thought that maybe my experience with numbers, with money, the fact that I'd run a bank that was big in Africa and Asia might be relevant. And it's a long story, but I ended up at the Global Fund. And the Global Fund has been an extraordinary experience. It's a privilege to run this partnership.
Well, that's all the time we have on Dateline Abuja. Mr. Peter Sands, thank you so much for making out the time to speak with us, and good luck with all the work you have ahead of you.
Well, thank you, Kelly. It's been great to be back in Abuja, and it's been a delight to be talking with you.
Thanks to my guest, Mr. Peter Sands, and to everyone who spoke to us today on the program. As of February of 2018, Nigeria was ranked 187 out of 191 countries in the world in assessing the level of compliance with universal health coverage. Very few Nigerians have health insurance. Government provision for health is still very poor. Out-of-pocket payment for health causes actually cause households to incur huge expenditures. Private expenditure on health as a percentage of the total health expenditure is 74.85%. The 1.58 trillion naira allocated to the health sector is also 8% of Nigeria's total budget of 20.51 trillion naira, compared to 5.35% for 2022. So there is an improvement, but so much more needs to be done. And we will be watching this health sector renewal compact and investment initiative very closely. That's Dateline Abuja this week. Please let us know the happenings in your neighborhood using the social media handles showing right now on your screens. Thank you so much for watching. I am Kayla Magwa. See you next time.